I'm David Wood. I'm one of the co-founders, John O'Kane, and I cannot believe I can't remember Logier. And Somml Health is, I am so excited about what we've been talking about tonight because we're looking at how do you get that patient involved. So we've put together a platform providing patients, specifically hospital patients, their families, and clinical care people, and bring them in, giving them real-time information and a way to collaborate so that we can help people long-term with their health care. And then that's not going to work. So, as Mike mentioned, there is a huge revolution that is going on in the healthcare industry. We all know there's a big problem that we can't have healthcare cost much more than it does now for the country. It's just too much money. And to do this, there are things like the ACOs that we talked about earlier that are finding ways that we're going to change payment models. So we're moving from, as we talked about, from a fee-for-service world to a value-based system where we're trying to keep people healthy. And how fast is that acceleration? Because people talk about in healthcare these trends that are going to happen sometime in the future. This one's going to happen right now. If you look, HHS, which is Medicare and Medicaid, is driving so that right now these alternative payment models that are only about 20 to 30% of the business right now are forecasted to go up to 50% of the business by 2018. And when I say forecasted, the person who's paying for the health care is saying that half of those dollars are going to be in value-based systems. So the question is, how do we find a way to change healthcare? And there are a lot of these different issues that are being taken care of, and we've found one place that we think we can help. Not the solution, but it is part of the solution, because as we've been saying here, patients are definitely an important part of this. So everyone has talked about, and we heard about it, and we've all heard different ways that we can engage patients. There's been big talk about patient activation. There's been talk about HCAHPS, quality scores. What can we do to get patients more involved in their health care? And it really comes down to this engagement thing being important because of what we're saying here. If we create partners, if we become partners in our health care, and we understand more what's going on in our healthcare, we're going to make better decisions. Okay? The old model of the doctor telling us what to do didn't work very well. So we have to find a model that actually does work, and you have to stay a certain distance away from the speaker, I see. So anybody who shows me going that way, push me this way, so I'll get back over on this side. But again, how do we partner? How do we create a partnership between doctors and patients so that patients control their health care, they're part of their health care, because it's about them. So if you push this out and see how this comes, what you can do from this, it's very unique. We can, if we now engage patients and families, and we include in the conversations nurses, doctors, and the therapies, and we actually even include in that conversation further primary care physicians, and we include the case managers that hospitals have, that some large practices have, and payers have. If we bring them all into one conversation, wouldn't it be cool that we could do some really, really interesting things? So how do you get there? And that's really the question. We come at this from the standpoint of as a more consumer-based team. Focus it on the patient. We see a lot of what's been done comes down from medicine. This is the way it's going to be doing. Our EHR systems, different ways that we push down to what the patient needs again. So instead, we asked a question, which I'm going to ask here instead of telling you the answer. So, how many people have had a problem where they have had a family member in the hospital? I don't want to show of hands, but had a family member that was in a hospital and you couldn't figure out what was going on, that you couldn't find out what had happened with rounds. Your mother was groggy when 5 a.m. the physician came through and gave some information, and she remembers it sort of, and then you spend the rest of the day figuring that out? Or how many times have you had tests done and it takes a day or two to find out? Or orders are done and you don't quite understand what those orders are, and you're just wondering, how can I get more information? So this was very important, and we decided that we needed to look into it further. So we came up with a solution by spending a lot of time at Albany Med. We are a member of their biomedical accelerator. We were the first company in residence. And what we saw was that what patients needed to become more activated so that they would listen to these conversations that we wanted them to be a part of, was they first of all needed that information. They wanted to know what that test result was. They wanted to know what that x-ray said. They wanted to know what was said to their mother at rounds, even if they were in Dubuque, Iowa. They still want to know what's going on. So how do you provide that information? And once you get that information, how do you create a space for collaboration that's secure, that brings together a variety of these people? It brings together family members. So it's not just, you're not spending all day talking on the phone with what was said at rounds. How do you get that information? And then longer term, as they come out of the hospital, how do you provide a way that doesn't overwhelm clinical staff so that you can provide a place for them to help monitor people's cares, all this Internet of Things that we've been talking about? How do you really get that in a different place? Well, the answer is we spent a year at Albany Med asking patients questions, okay, a year. What does that matter? Well, if anybody who's done a consumer health app or any app understands, part of what you're trying to do is figure out how can you get people to use this? And so we've spent a lot of time talking to patients, talking to families, talking to clinicians, talking to nurses, to understand really what are the pieces that are going to be important so that we can all be involved in our healthcare and have a positive collaboration with physicians, nurses, in a way that isn't going to overwhelm the physicians and nurses, to better ourselves, to maintain good healthcare. So how far are we in this vision? We're pretty, well, it's been a long road, and we feel we're pretty far. We've just entered our pilot at Albany Med. It's some other people I've seen who've known this. We've talked for about a year about this, about the idea of it. But now we actually have a product that we are piloting at Albany Month, meeting our goal to pilot in the fourth quarter of this year. We plan to move from our Albany Med pilot, which is part of our program, part of being a member of the biomedical accelerator. We're planning on doing a long pilot with them to continually improve the product, and then also move to paid pilots at 2 to 3 hospitals next year and enter into full release the year after that. Now, a lot of people who hear that then go, oh, David, you're not shooting for the moon. Well, we're not, but we actually understand that if we can accelerate this, hospital payment cycles are really long to buy things, so we anticipate it will take some time to get people going, but we're always willing to move quicker if anybody would like to buy a system. We're happy to sell one tonight. We don't have a test, but we can figure that out. So, competition. Is there any competition? We look at what we're doing is a unique perspective from what most people are doing, and it's something we've done before, Kurt and I have done before in other industries. How can you work with the hospitals, but to provide them something that they need? They need their patients to be engaged and be part of the conversation. And we help them do that. EHR vendors are really good at providing record systems and the information on what happened and making sure that they bill correctly. Portals, really good at giving you the information that's gone on. And there are some startups that are beginning to have some collaboration between coaches and thinking about that are out there, which is these people in the middle. But nobody's really looking at how do you bring real-time information and bring that collaboration together. So who are we and why could we possibly do this? Well, Kurt's last, I've known Kurt for 20 years. I was actually a venture capitalist a number of years ago, and I funded one of his first startups. I led 2 rounds that were about $7 million, and we ultimately sold that company to the newspaper industries that it was started in. Kurt last was the head of digital for Dow Jones Local Media, responsible for bringing products out to consumers. I have had a history as an entrepreneur and as a venture capitalist. One of the last ventures I did just sold to a public company. We've put together a team of other people around that, but I want to stay true to our time. And John is one of those people who has extensive experience in the healthcare industry. His photo's not there, but he's there. And then we have a rich network of advisors, some of which we've listed here. Dr. Blinkhorn is the chairman of medicine at Albany Med. He is effectively our chief medical officer. He is one of our key advisors, as is Louis Philhauer, who is the senior vice president of quality over at Albany Med. And Jacob Ryder, who happened to be the deputy head of the area of the federal government that actually controls all of this, is also an advisor to our company. So I spoke a little bit about this. We also have partnerships, as I said, with Albany Med and with the Severino Center over at RPI. I'm actually an entrepreneur in residence there, and they've been very helpful in a number of ways. And taking care of to be just a teeny bit technical, there is a huge integration issue and issues whenever you're dealing with medical data, and we partnered with another startup called Mana, and utilizing their cloud, which is really rocking it so far, to surface the health data in a way that we can use easily. So thank you so much, and that's Somml Health.
Thank you, David. We have time for a question. Start up front here.
Thank you. Could you explain a little bit more of the value proposition for a hospital somehow?
So exactly, hospitals there are several measures that are part of the value-based billing that you have, whether you're HCAHPS, and those are the main that we're looking at. Anybody else understand that in the room? So in healthcare, you get the hospital come back to the hospital too quickly. Or if they don't, that's another penalty that is all growing. That's that 90% thing that I was talking about. So hospitals have a huge, their patients happier, and to have them not.
One more.
What happens in your pilot say? Maybe I missed something. Maybe I'm a patient in a bed, or I'm the physician. What's happening in your study?
So now in a little bit I'll give you, and they're supposed to be far away from you. So I do actually have a working prototype in this pocket, and we may be able to bring it out afterwards. So what's that? It will go on your phone. So the idea is you go into the hospital and a nurse comes up to you and says, hey, you should be using Somml Health, because that will give you all your real-time information, and you should invite your family to be part of this so they can see what's going on too. And by the way, through that, you will know what's going on, and you'll be able to ask questions in a variety of ways, okay, and get more information. Okay?
Thank you,
Thank you
David.
so much.